If your leg pain is shooting, burning, tingling, or going numb, you've probably been told one word over and over again about sciatica. But here's the problem. That label is causing thousands of people to chase the wrong stretches, the wrong treatments, and the right help. Now, I've worked with countless people who were convinced that their pain was coming from a disc when the pattern clearly pointed to something else. Now, that could be spinal narrowing, deep glute irritation, trapped nerves near the ankle or knee, or even circulation problems that look like nerve pain but aren't. In this video, I'm going to break down the 7 most common causes of a nerve-related leg pain and show you a simple pattern matching checklist you can use in under 60 seconds. Now that's going to help you figure out where your pain is most likely coming from and what to do next. Now, we're going to walk you through where the pain starts, what triggers it the most, and how it travels down the leg, what it feels like, and what actually makes it better or worse so you can stop guessing, stop doing random exercises, and have a smarter conversation with your doctor or therapist. And then at the end, I'm going to show you the biggest mistakes people make with sciatica type pain that quietly makes things worse over time and how to avoid them. I'm Dr. Lee. I'm a chiropractor here in San Jose, California, and with more than 20 years experience helping people with disc injuries, back pain, even sciatica, who have tried everything and still live with pain, I created this channel to give people real, non-surgical, science-based solutions that actually address the root cause instead of masking the symptoms. Now, if you want to protect your spine, understand the condition, and learn treatments that help people get long-term relief, subscribe to my channel. I post a new video every week. Most people hear the word sciatica and they think they finally have an answer. It sounds specific. It sounds like a diagnosis. And that is exactly why it causes so much confusion. In reality, sciatica is just a term used to describe symptoms such as pain, burning, tingling, or numbness that travels down the leg. It tells us what you are feeling, but it does not explain why it is happening or where the problem is coming from. The distinction matters because very different problems can create the exact same leg symptoms. Now, this is why many people get stuck. When everything is called sciatica, the advice becomes mixed. One person is told to stretch, another is told to rest. Someone else is told to push through it. Some people improve while others feel worse. From the outside, it feels random and frustrating. From a clinical point of view, it usually means the underlying cause is different. And this is not a failure on your part. It is not because you are not trying hard enough or doing the wrong thing on purpose. It is because a treating label, instead of understanding the source, almost always leads to confusion. Once you understand that sciatica describes symptoms and not a single cause, the next logical step becomes clear. You need to know what types of problems can actually create nerve-related leg pain, which is exactly what we're going to cover next. When I look at nerve-related leg pain, I do not treat it as one problem. I look at it in a small number of small common causes that tend to show up again and again. Now, there are 7 causes of leg pain that you need to know of. And once you know them, the symptoms stop feeling random. Cause number 1, lumbar disc bulge or herniation with a nerve root irritation. Now, this happens when a bulging disc or a herniation in the lumbar spine irritates a nerve as it exits the spine. Now, pain often starts in the lower back or the buttocks and travels down the leg. It may even change when you sit or you bend, or certain movements. It can be sharp, shooting, or paired with tingling or numbness. When this type of nerve irritation is present, the pain usually follows a very specific pathway depending on which nerve is involved. And these patterns are not random, and recognizing them can be very helpful. L4 nerve root pattern pain commonly travels from the lower back or the buttocks into the front of the thigh, down towards the inner knee and inner shin. Some people notice discomfort or weakness when straightening the knee or going up and down stairs. Tingling or numbness is more likely along the inner lower leg rather than into the foot. Now, an L5 nerve root pattern pain typically moves from the lower back or the buttocks down the outside of the thigh, across the front or outer part of the shin, and into the top of the foot or big toe. Now, this is one of the most common patterns people are told when they have sciatica. People may notice difficulty lifting the foot or toes, and symptoms often worsen with bending forward, sitting, or prolonged driving. An S1 nerve root pattern usually starts in the buttocks and travels down the back of the thigh into the calf and towards the outer foot or heel. Now, some people notice weakness when pushing off, while walking or climbing stairs, and symptoms may increase with standing, walking, or straight leg movements. A key pattern to remember is this. Disc-related nerve pain usually begins in the lower back or buttocks, follows a clear and consistent path down the leg, and often changes with spinal position or movement. That combination strongly points to the spine as the source of the problem. Now, cause number 2, spinal stenosis. Now, this is a narrowing around the spinal canal, which can compress the nerves in the spine. Now, it tends to feel different than your classic sciatica. People often notice achiness, heaviness, or fatigue in the legs that builds up with standing or walking and improves when they sit down or they lean forward. Now, a key feature of this pattern is that the symptoms are usually activity dependent rather than position specific. The legs may feel heavy, tired, weak, or crampy after standing or walking for a certain distance, even if there is very little pain in the lower back itself. Now, some people describe it as their legs giving out or not wanting to cooperate the longer they stay upright. Another important clue is that flexed positions feel better. Sitting down, bending forward over a shopping cart, or leaning onto a counter often brings noticeable relief, sometimes within minutes. And in contrast, standing upright or walking downhill can make symptoms worse. Now, this pattern helps distinguish spinal stenosis from disc-related nerve pain, which often worsens with sitting or bending and follows a sharper, more defined nerve pathway. Now, with stenosis, the symptoms are usually more diffuse. They build gradually and are closely tied to how long you are upright or moving. Cause number 3, piriformis or deep glute irritation. Now, in this case, the sciatic nerve is irritated outside of the spine as it passes through the muscles in the buttocks. Now, symptoms are often worse with prolonged sitting or driving, and moving the lower back may not necessarily change the pain very much at all. Now, a common clue with this pattern is that the discomfort feels deep in the buttocks and may worsen when sitting on one side, crossing the legs, or after long periods of driving. Now, the pain can travel down the leg, but it usually does not follow as clean or predictable nerve pathways as a disc-related pain. Now, another important distinction is that the spinal movements often have little effect. Bending forward or backwards may not significantly change the symptoms, while direct pressure, prolonged sitting, or certain hip movements tend to provoke it more. Now, this helps separate deep glute irritation from true spinal nerve compression. Cause number 4, peripheral neuropathy. Now, this involves irritation of nerves away from the spine. Symptoms often affect both legs and may feel like burning, tingling, or altered sensations rather than sharp pain. It usually does not follow a single clear path down one leg at all. With this pattern, symptoms are often more symmetrical, affecting both feet or both lower legs rather than one side only. People frequently describe a burning, buzzing, pins and needles, or numb sensation that starts in the feet and then slowly moves its way upwards over time rather than beginning in the back or the buttocks. Now, another key feature of peripheral neuropathy is that symptoms are less influenced by spinal position or movements. Sitting, bending, or changing position may not significantly change how the legs feel at all. Instead, symptoms can be more noticeable at night, at rest, or when shoes or socks touch the skin. Now, because of the irritation and the irritation that is happening along the peripheral nerves themselves, the sensations tend to feel diffuse rather than directional, which helps distinguish neuropathy from disc or stenosis patterns that follow more clear mechanical rules. And to tell you the truth, a lot of neuropathy patients, they don't have any pain at all. Cause number 5, entrapped nerves in the leg. Now, this occurs when a specific nerve becomes compressed or irritated along its path in the leg. Now, common examples include peroneal nerve entrapment, which typically causes symptoms from the outer knee down to the top of the foot, tarsal tunnel syndrome, which affects the inside of the ankle and it can cause burning or tingling along the bottom of the foot, and myalgia paresthetica, which tends to lead to numbness or burning along the outer thigh. In these cases, symptoms are usually more focused and stay below the area where the nerve is trapped, rather than starting in the lower back itself. A helpful way to recognize this pattern is that the symptoms are often very localized and tied to a specific region of the leg, ankle, foot, or thigh, and people can often point to one small area where the problem seems to begin, rather than describing the pain that starts in the back or buttocks and travels downward. Another key feature is that back movements usually do not change the symptoms. Sitting, bending, or extending the spine may have little effect, while local pressure, certain positions, tight footwear, kneeling, or repetitive movements tend to make the symptoms worse. Because the nerve is irritated farther down in its course, the sensations usually stay below the site of compression and do not climb upwards towards the spine. This clear cutoff is an important distinction from disc or spinal causes of nerve-related leg pain. Cause number 6, sacroiliac joint or pelvic referral that mimics nerve pain. Now, pain from the sacroiliac joint can refer into the leg and closely resemble nerve symptoms, even though the nerve itself is not directly irritated. Now, with this pattern, discomfort is often felt deep in the low back, the buttocks, or the hip, and may spread into the thigh or even below the knee. Now, the pain can feel sharp, aching, burning, which is why often it is mistaken for true nerve pain. Now, a key distinction is that the symptoms tend to be more mechanical and movement-based. Activities like standing on one leg, walking, rolling in bed, or transitioning from sitting to standing often aggravate the pain, while classic nerve tension tests may be less provocative. Now, this referral pattern explains why some people have leg pain that looks like sciatica, but does not follow a clear nerve pathway. Cause number 7, circulation issues. Now, some circulation problems can feel very similar to a nerve pain. These symptoms are often triggered by walking and improve with rest, which is an important clue and one that should not be ignored. With this pain pattern, leg discomfort often feels tight, crampy, heavy, or achy rather than sharp or electric. Symptoms typically begin after walking a certain distance and ease relatively quick when you stop and rest, even without unchanged positions. Now, unlike spinal causes, sitting or bending forward does not necessarily bring faster relief. Now, another key difference is that symptoms are consistently distance related. The same amount of walking tends to reproduce the discomfort, and the pain does not usually follow a clear nerve pathway from the back down the leg. Because circulation-related pain requires very different approaches, recognizing this pattern is crucial. Stretching, nerve exercises, or spinal treatments are not the solution, and the proper medical evaluation becomes a priority. The key takeaway is that each of these causes of nerve-related leg pain behave differently. That is why treating everything as sciatica rarely works. And this is exactly why the next step is to learn how professionals recognize patterns in symptoms to sort these causes apart, which is what we will talk about next. Now that you know the 7 causes, the next step is simple. Stop treating this like one condition and start looking at the pattern. Now, I'm going to walk you through how health professionals sort leg pain out. But first, it is important to know that this video is for clarity and education, not a diagnosis. A proper evaluation by your doctor, chiropractor, or a specialist is always recommended. Here are the 4 things we look at. First, where the symptoms begin. Does it start in the lower back or buttocks? Does it travel down, or does it begin farther down in the leg, ankle, or foot? Second, what triggers it the most? Sitting and bending, walking and standing, nighttime, driving, or certain hip positions? Third, what it feels like. Sharp and shooting, burning and tingling, or more heavy, tired, and crampy? And fourth, what brings relief? Does sitting help? Does leaning forward help? Does rest calm it down? Or does changing posture do almost nothing? These 4 clues usually place you into one of the 7 buckets we just covered. And once you are in the right bucket, the next step becomes much clearer. Step 1, identify your pattern. Note where it starts, what triggers it, what it feels like, and what relieves it. Step 2, match it to a likely category. Now, lower back or buttocks first. Clear pathway down the leg, often tied to sitting or bending. That fits a disc or nerve pattern. Leg heaviness or maybe even fatigue with walking or standing. That improves with sitting or leaning forward. That fits a stenosis pattern. Deep buttock pain that flares with sitting or driving and doesn't change much with back movements. That fits a deep glute pattern. Burning or tingling in both legs that does not follow one clear line. That fits a neuropathy pattern. Very localized symptoms starting at the knee, ankle, or foot, or outer thigh with little change from back movement. That fits a nerve entrapment pattern. Leg symptoms, triggered by walking that reliably improve with rest. That can fit a circulation pattern. And if it feels like sciatica, but does not match a clear pathway, especially if it is tied to transitions or uneven loading through the hips, that may fit an SI or pelvic referral pattern. Step 3, choose the right next step. Instead of random stretches, generic exercises, choose care that matches the category. Chiropractic adjustments, physical therapy, rehab, exercises. and spinal decompressions are some treatment methods that can be very useful. Now, sometimes it may mean modifying what you are already doing. Sometimes it means getting a proper exam that looks at movement, posture, strength, reflexes, and how your symptoms behave, not just one image. And step 4, do a safety check. If you have new or worsening weakness, trouble lifting the foot, numbness in the groin area, changes in bowel or bladder control, severe or rapidly worsening pain or symptoms linked to a fever or trauma, you gotta get medical evaluation right away. Now take a moment and think about which of these patterns sounded closest to you. If one stood out, leave a comment below and share it. I hope this video gave you clarity about why nerve-related leg pain can be so confusing and helped you see that your symptoms are not random. When you understand the pattern behind the pain, it becomes much easier to feel hopeful and confident about the next step instead of feeling stuck and overwhelmed. Now, if you found value in this video, please like and share it so others who are dealing with similar pains and confusions can benefit too. And always remember, this information is meant to guide your thinking, not replace professional care. Be sure to get a proper evaluation from your doctor or chiropractor so you can make decisions that are right for you. If you want to protect your spine, better understand your condition, and learn treatments that help people get long-term relief, make sure to subscribe to my channel. I release a new video regularly to help you move forward safely and confidently. And the next video you should watch is the one linked right here, where I will walk you through 10 exercises for L4-5, disc bulge, and back stability so you can continue building on what you learned today.